So then, to the European level, Pierre, the Innovative Medicines Initiative, obviously you took over last September, I think you started in your current role. And I know you've been involved in efforts in Canada around genomics and also in Ireland, all of which I think are at that sort of, obviously different emphasis, but IMI is obviously big in terms of scale. There's a lot of projects underway. And what do you think the value is that it's bringing to the table that wasn't there before now?
So thanks, Cormac, and thank you for inviting me to talk a little bit about IMI. You're right that we're dealing with a industry sector that traditionally has been highly competitive. Very little collaboration amongst the players until recently. And, but a realization now that they have to collaborate. And the IMI platform incentivizes that to a certain degree. And also addresses challenges where not only companies can't address them even alone, but we need the creativity and research clout of the academic to bring some innovative solutions. So we are lucky that we can do this at some scale, which is significant, and that we can address some topics where for the industry now it's a kind of no-brainer to collaborate on. So in the vaccine area, for example, immune correlative protection, where human immunology, experts in human immunology from the academic sector can bring a lot of new knowledge that can be used. Biomarkers, safety biomarkers for vaccines, for example, where these can be shared amongst the industry players in a non-competitive or pre-competitive space. And so those big topics, which are very much actually in line with some of the roadmap that you'll hear later on from Patricia, which we certainly applaud, and looking at that, we can go a lot further in trying to defragment what's going on in Europe, I think. But we are lucky to have this kind of neutral platform where people can come and work together and de-risk. This is a word that keeps on coming up. De-risk some of the challenges that and some of the important investments that the private sector are putting forward.
And when all that gets done, when the biomarkers are validated and put to use, when the immune correlates of protection are understood and absorbed into vaccine development pathways, and looking at just through the prism of vaccines alone now, not the other agendas of the IMI, I know it's much, much broader than that, but what do you think is the end game in terms of outputs? What do you think it's going to deliver?
Well, so the way IMI was created was a very balanced view of advantages to the European industrial ecosystem, including the involvement of SMEs. We have about 16% of what we do is through SME. So that's one output where we're incentivizing R&D spend of big industry in Europe. We're incentivizing the growth of SMEs. And then because there's a lot of public money going in from the European Commission, there obviously has to be a public value. So what is that public value to the European citizen? And that is to do with access to innovations, to more safe and effective vaccines, and so on and so forth. So I think that it's a balanced approach that we have, and I think it's very important to insist on one hand to the value to the industrial ecosystem in Europe, but also the value to the European citizen.
And obviously I know it comes from Europe, it's funded by Europe, but globally as well, do you think you're doing enough, or is it on the agenda to address disease burdens in the global south?
Yes, so of course most of the things that we do have global impacts.
Yeah.
As you know, we have a very large program on antimicrobial resistance.
Yeah.
And so linking in with the rest of the world in that way, we have a big Ebola program. Some of that work was done in Africa.
Yeah.
So obviously a lot of, we can't be a European island on this for sure. We also are in a position where we attract investments from others. So the Gates Foundation have just put in a considerable amount of funding for a pertussis project that's about to be launched, and so this is also attracting investments from elsewhere.
Okay, very good. Thank you.